and thank you for joining us for our daily briefing in the fight against COVID-19. I'm joined today by Dr. Jenny Harris, the Deputy Chief Medical Officer, and Professor Stephen Powis, the Medical Director of NHS England. I'd like first to update you all on the facts about the spread of COVID-19 and the steps that we are then taking in the battle against this virus. 143,186 people have now been tested for the virus. Of those, 25,150 have tested positive. And sadly, yesterday we recorded the highest single increase in the number of deaths as a result of COVID-19. 381 people died, meaning that of those hospitalised in the UK, the number who have passed away now totals 1,789. Every death is the loss of a loved one, and our thoughts and prayers are with those who are grieving. Overall, 10,767 people in England have been admitted to hospital with COVID-19 symptoms. The largest number of those is in London, with 3,915 people in hospital care, while in the Midlands, the number of those hospitalised is now 1,918 and accelerating upwards. These numbers reinforce the vital importance of following the government's social distancing guidelines. The more we restrict contact, the more we slow the spread of the infection, the more that we can help the NHS build the capacity needed to care for those most in need. And that capacity is increasing. More NHS staff are returning to the front line, and more testing is taking place to help those self-isolating come back and to protect those working so hard in our hospitals and in social care. But while the rate of testing is increasing, we must go further, faster. A critical constraint on the ability to rapidly increase testing capacity is the availability of the chemical reagents which are necessary in the testing. The Prime Minister and the Health Secretary are working with companies worldwide to ensure that we get the material we need to increase tests of all kinds. And as well as increasing the number of staff on the front line and the tests which protect them, we must also increase the capacity to provide oxygen to those worst affected by the disease. We have just over 8,000 ventilators deployed in NHS hospitals now. This number has increased since the epidemic began, thanks to the hard work of NHS professionals. But we need more. That's why we are buying more ventilators from abroad, including from EU nations. And it's also why we're developing new sources of supply at home. Before the epidemic struck, we had very little domestic manufacture of ventilators. But now, thanks to the dedication of existing medical supply companies and the ingenuity of our manufacturing base, we have existing models being produced in significantly greater numbers and new models coming on stream. Orders have been placed with consortia led by Ford, Airbus, the Formula One racing teams, including McLaren, GKN Aerospace, and Rolls-Royce and Dyson's. And I can announce that this weekend, the first of thousands of new ventilator devices will roll off the production line and be delivered to the NHS next week. From there, they will be rapidly distributed to the front line. And as well as increasing the capacity for ventilation, which helps support those patients worst affected, we're also increasing the capacity to provide oxygen to affected patients at an earlier stage in the process of the disease, helping to avert, we hope, the deterioration of their condition. A team led by UCL, working with Mercedes-Benz, will produce 10,000 new CPAP devices to support affected patients, and a team from Oxford University are also developing related technology. And in our determination to prevent as many patients as possible seeing their condition worsen, we are conducting rapid clinical trials on those drugs, including anti-malarials, which may be able to reduce the impact of COVID-19 on those affected. But even as we seek to explore every avenue to slow the spread of the disease, to reduce its impact, and to save lives, I'm conscious of the sacrifices that so many are making. That's why the Chancellor's economic package is in place, to support people through a difficult time. It's also why we are working so closely with our colleagues in the devolved administrations to coordinate our response across the United Kingdom, and I'm grateful to them, as I am to the thousands of dedicated public sector workers, cleaners and social workers, prison and police officers, those in the Royal Mail and in our schools. And I want to thank them, and also the leaders of the trade unions who represent them. In this united national effort, we're also delivering food and prescription drugs to up to 1.5 million of the most vulnerable who are self-isolating for 3 months. And we will do more to help, working with the 750,000 people who volunteered to help at this time. Many are already heavily involved in local community support schemes. And we want to work with them to ensure that we support not just the 1.5 million most vulnerable to the disease, but all those who need our help through this crisis. Those without social support, those in tough economic circumstances, those who need the visible hand of friendship at a challenging time. That's why my Cabinet colleague George Eustace and the Food and Farming Minister Victoria Prentice will be leading work with food suppliers, retailers, local authorities and voluntary groups to support our neighbours in need. I also want to thank the men and women of the military who've stepped up their work as part of the ongoing response to coronavirus. 3 RAF Puma helicopters are now stationed at Kinloss Barracks in Murray. These Pumas are working closely with a Chinook and a Wildcat helicopter based at RAF Leeming in North Yorkshire to meet requests for assistance from NHS boards and trusts across Scotland and Northern England. A second helicopter facility covers the Midlands and Southern England, working out of the Aviation Task Force headquarters at RAF Benson in Oxfordshire. Chinook and Wildcat helicopters, normally based at RAF Odium and RNAS Yeovilton respectively, support the southern areas. And these helicopter facilities have been set up to support medical transport across Scotland and the rest of the United Kingdom. The task force is also available for general support, such as moving equipment and personnel to where they are needed across the United Kingdom. And the Kinloss-based support follows the use of an RAF A400M transport aircraft working with the Scottish Ambulance Service to evacuate a critically ill patient from the Shetland Islands to Aberdeen to receive intensive care treatment. I'm deeply grateful for everyone in the armed forces and in the public sector who are doing so much to help us in the fight against coronavirus. And of course, all of us can continue to play our part in supporting them and the health service by staying at home, supporting the NHS and saving lives. Now, I want to ask Stephen to run through the latest data from our Cabinet Office coronavirus fact file. Stephen.
Thank you. So our incredible staff in the NHS are working round the clock, pulling out all the stops to prepare for the expected surge in patients with COVID-19. I saw that myself at the NHS Nightingale Hospital in East London this morning and was completely bowled over by the work that is being done there, from a standing start a week ago to a new hospital that will be ready to take patients later this week. But as we have repeatedly said, and as you have just heard, NHS staff cannot do this on their own. Yes, we can increase capacity, but we also need everybody in the country, every one of you, to help by reducing the transmission of the virus, because it is by doing that that we will reduce the number of deaths and we will take the pressure off our hospitals and our health system. And the charts that I'm about to show you will show you why that is so important. So, all the interventions, all the instructions that the government have given, based on the best possible scientific advice, and similar to the approach being taken in many countries around the world, are designed to reduce social contact. In other words, to reduce the chance that the virus is passed from one person to another. And by doing that, the spread of the virus reduces and the number of infections reduces. I'm pleased to say that the great British public are paying attention to that message, and we see in many ways that amount of social contact is now reducing. So this first chart shows you an example of that, transport. And as you can see, the number of people using our transplant services has reduced dramatically over the last few weeks. So for example, you can see in the light blue line that transport in London on the tube has decreased dramatically, which demonstrates that people are paying attention and understand the message we are giving. And there are many other examples that show that that contact is being reduced. As the next chart shows, that plays into an impact on the number of infections. So the less social contact, the less the chance is that the virus can move from one person to another. And that will, over time, reduce the number of infections that we are seeing, the number of people testing positive. And you can see here that we have had a rise in the number of new UK cases, but recently there is a little bit of a plateau. Now, I think it's really important not to read too much into this, because it's early days, we're not out of the woods, we're very much in the woods, and it's really important that we keep complying with those instructions. But as you can see, the number of infections is not rising as rapidly as it was. So green shoots, but only green shoots, and we must not be complacent and we must not take our foot off the pedal. Now, if infections fall, as the next chart shows, that will also translate into fewer hospital admissions. Hospital admissions typically occur a week or two after an infection. And remember, for the vast majority of people, COVID-19 is a mild flu-like illness, a heavy cold. But for a small percentage of people, hospitalisation is required. Now, you can see here that the rate of hospitalisation has been increasing, and we would expect that at this stage in the epidemic. But if those infections start to drop, then in the next few weeks, our hope is that the number of hospitalisations will also start to reduce. Now, the good news here is that that line is not going up very steeply, but it is still rising. We're not out of the woods. We need to keep our foot on the pedal. And as you can see there, around a third of the hospital admissions are in London because, as we have said and as we know, the infection is spreading more rapidly in London, and London is a bit ahead of the rest of the country in terms of this epidemic. Now, as the next chart shows, hospitalisation, unfortunately, some people who are hospitalised do die. Every death is tragic, and we absolutely need to avoid as many deaths as possible by all playing our part. So what we want to see over time is a reduction in the number of deaths. And you can see here a comparison of deaths in different countries, and you can see maybe in the very light line in the middle that China, over time, has flattened that particular line. In other words, the number of deaths have reduced. And so if we reduce the number of infections, we will reduce the number of hospitalisations, and we will reduce the number of deaths. Maybe some green shoots, but the last thing I would want is a message to anybody that this is a time to take our foot off the pedal, to not comply with the instructions, because this is not a short haul. As we've said, this is going to take time, and it's important that we all stick with it. Everybody. Thank you.
Thank you very much, Stephen. We'll now go to our colleagues in the media to ask a series of questions. And first we turn to Hugh Pym of the BBC. Hugh.
Thank you. Many NHS staff are saying that testing for them is not obviously available in their places of work now or somewhere accessible, even after pledges made by officials and ministers in recent weeks it was a priority. What do you say to them?
Well, Hugh, we want to increase the number of tests. We are increasing the number of tests. I mentioned earlier that one of the constraints on our capacity to increase testing overall is supply of the specific reagents, the specific chemicals that are needed in order to make sure that tests are reliable. It's also the case, as I'm sure you're aware, that we've been working with the private sector and with academics, and Boots, for example, have increased the number of drive-in centres for NHS and frontline workers to be tested. But I'll hand over to Stephen first of all.
So you're absolutely right, Hugh. It's absolutely crucial that NHS staff are testing. And as I've said before, that's for two reasons. One, because those who are self-isolating because they have symptoms or are in household quarantine because one of their household has symptoms, they may not have this virus. It's still possible that they have another cold-like illness. And if we know that they test negative or their relative tests negative, then we can bring them back to work. And that's important, obviously, at a time when the NHS is under pressure. And then secondly, if they have had the virus, then it is likely that once they get over the infection, they will be immune, and that's really important to know as they come back to work. So I'm really pleased to say that as testing ramps up, it is producing the capacity to increase our testing of staff. We wrote to all NHS trusts on Sunday to ask them to start to produce lists of the staff that are most key and that they would want to test first, or the households that they would want to test. And they are already doing that, and we are beginning to ramp up the testing of staff exactly as Sir Simon Stevens promised on Friday when he was here.
Thank you, Steve. Jenny.
Just to add to those comments, I think you will know that we've been, as Stephen said, ramping up the capacity within the NHS, and we're heading towards 25,000 on that. I think we're up to about 12,700, so that's a steady increase over the last few days. So that represents additional capacity there, as we've just mentioned. But there is, of course, another element to this, which is if you are an ill member of staff, you do not want to be going into your hospital to be tested. We want you to stay away. And the really positive development there would be to ensure that our postal testing system is operational, because that will be much easier both for the staff that we would like to offer that to, and in due course to other frontline workers, and then potentially onto the public. And that testing is ongoing, a bit like the reagents thing. You have to make sure that the time period of the postal sample doesn't allow for the virus to degrade as it goes through, or we'll end up with an inaccurate test. But there is a lot of testing going on for that at the moment, and that will be, I think, a really helpful practical mechanism for NHS staff to use.
Thank you very much, Jenny. I'll turn now to Robert Peston from ITV. Robert.
Good afternoon. Good afternoon. 3 weeks or a week ago, when the Prime Minister introduced those restrictions on our freedom of movement, he said it would take 3 weeks for us to know whether those restrictions would allow the NHS to cope. Stephen has talked today about green shoots. Does that mean that you are more confident than you were that the NHS will cope? And could you just give us a sense of the data that gives you that confidence, if you are a bit more confident? And a couple of other quick things. Every day we're deluged with statistics about how much protective equipment is in the system. But equally, every day doctors come to me and they say they don't feel protected. They are not getting the equipment. Why is there that mismatch between the volume of equipment and it actually getting to people? And then finally, even if the NHS is better able to cope than perhaps we feared a few days ago, there are still record numbers of deaths in hospitals in a short space of time. Are you expecting to give any new guidance to doctors about when it's appropriate to send somebody home to die because they are so frail that the prospect of surviving in hospital is slim, and it is probably better for them and their families that they die with their loved ones?
Thank you, Robert. Let me try and answer in part at least the first two questions, and then I'll ask Stephen and Jenny to come in. Stephen is right. There are some signs as a result of people observing social distancing that we may be able to flatten the spread of infection, but now is absolutely not the time for people to imagine that there can be any relaxation or slackening. This is a hopeful sign, but we must be, as Stephen pointed out, wary of over-interpreting any individual day's data. We must ensure that we maintain this united national effort in order to keep people safe. That's the first thing. So I just wanted to emphasize, as Stephen did, that people's efforts, people's sacrifices are worth it. They are making a difference, but we must not let up. On your point about personal protective equipment, we know that just yesterday, hundreds of thousands of aprons, eye protectors, respiratory masks, surgical masks and gloves reached the front line. And there is a 24-hour helpline. If any frontline NHS worker is concerned about not having the PPE equipment that they need, they can call in order to make sure that PPE equipment can be delivered. But I'll hand over to Stephen to say a little bit more, and then to Jenny. Stephen.
So I honestly think it's too early to tell at the moment, and I very specifically used the term green shoots because they are just green shoots, and winter could come and those green shoots could turn out to be not the hopeful green shoots that we thought they might be. But I think the next week or two will be critical as we move through. As I said in those charts, there are signs, as Sir Patrick Vallance said yesterday, that transmission in the community is reducing. That's exactly what we would expect if the public comply with the measures to reduce social contact. But there is a lag, as I described, before we see that in the number of hospital admissions and then in the number of deaths. So I think the next week or two are going to be critical, but this is a start of a battle. We can stop this virus, but we're at the start, and we mustn't let go of the measures and let go of everything that we're doing. We have to keep the foot on the pedal, as I said, no complacency. I want to encourage the public that they are playing their part, but I don't want to give the message that we need to do anything other than maintain our compliance with the instructions. Everybody needs to do that because that is the only way that we will get through this.
Thank you, Stephen. Jenny, I don't know if you want to address Robert's third question, a sensitive question, obviously, about...
I can do... I'm happy to start on that one, and also I was going to contribute on the PPE question, which I might start with, and if that's okay. So I think if your question was quite interesting, actually, because the way that you posed it around personal protective equipment was very much about were people getting it and how did they feel about it? And I think that is actually really critical. So I think the first thing to say is the UK has always had sufficient stocks to date that it needs against its guidelines, and those guidelines are amongst the best in the world. The WHO actually produced a statement at the weekend very much supporting our guidance on that. It's equivalent to Australia, Canada, it's supported by the European Society of Intensive Care and the Society of Critical Care Medicine. So there is a strong evidence base around what we recommend. I think there has been a lot of concern in the system about whether our guidance differed in any way, and we are continuously reviewing that to the extent that we have asked the Health and Safety Executive to have a look, and they have produced some very positive guidance on that. And equally, there was a report by Tricia Greenhalgh around face masks, which was also very supportive of the position we have. So we are continuously checking. I think one of the issues and I have to admit, I stood here, I think, about 10 days ago and said, very probably optimistically now in the past, we've solved the PPE position. So my apologies, because 48 hours later, I think, our distribution issue had popped back in again. And so the distribution element has been a little bit tricky at times, and we have now taken a whole strand of the logistics, including with the Army support actually, out so that we are developing a UK position on that stock and distribution flow. And the underlying critical point about this is that the PPE should go to match where the critical clinical risk is. So that doesn't matter whether you are a consultant in an A&E department or a domiciliary care worker looking after a resident at home. You may not have the same PPE. In fact, I would expect you not to have, but the PPE that you have is proportionate to the risk exposure that you have. That's really important. So it doesn't matter where you are in the system. So I think there have been some distribution issues. We're developing an e-system, so that will make it much easier for example, for care homes to have that. But then I think I wanted also to address the second point, which is actually how people feel. So Steve and I almost certainly have colleagues, friends, family working on the front line and are very attuned to how it feels. Just as it does for the rest of the public, this can feel quite frightening at the moment. And if you are continuously seeing patients coming through the door, that is particularly the case. So we're very attuned to this, and what we have been doing over the last few days is reviewing our guidance to see if, although we're quite satisfied with the technical basis of it, if we can make some small tweaks, if you like, to ensure that people feel safer in what they're doing, and we're addressing that over the current period.
Thank you, Jenny. Did you want to address Robert's point about... or Steve?
Yes. End-of-life care is obviously incredibly important. And I think one of the aims that we have tried to maintain throughout this by increasing the capacity of the NHS and also suppressing the virus and reducing the demand on the NHS is to ensure that clinicians, doctors, nurses can manage patients as they always do. and manage end of life as they always do. So I would expect end of life care to be just as good as it is in normal times. And I know that's something that our clinicians and hospitals and other healthcare facilities are thinking about very carefully. Clearly, with the additional impact of the virus, this particular virus, we do need to think carefully about when people are discharged from hospital, if they have had COVID, and so we have issued specific guidance to assist in that discharge, for instance, discharging into care homes. So we've taken account of the fact that over and above our normal procedures, we need to take account that we have a new infectious disease.
Thank you very much, Stephen. And I want to turn to Charlotte Ivers of Talk Radio. Charlotte.
Thank you, Mr. Gove. Germany and South Korea have been held up as examples of how to get this right. How would you all describe the UK's response relative to that, better or worse? And if I may, Mr. Gove, can we expect to see tax rises in the next couple of years after all of this is over?
Well, thank you, Charlotte. We learn from other countries. We collaborate with other countries. And I think that it's certainly the case that different countries with different healthcare systems have approached dealing with the virus in overlapping complementary ways. I think that one of the things I would say, just observing it, is that the NHS has formidable resources and advantages. The dedication of our staff, the fact that we can stand up a new hospital like NHS Nightingale so quickly, and the quality of the data and the scientific input that I see when I observe the work of dedicated NHS professionals and scientists, well, I'm in awe of it. So I think that we should be, all of us, grateful that we have the NHS and that we have the academic excellence that underpins it. But of course, we can and are learning from other nations in their approach to dealing with the virus. On the question of the economic choices for the future, I think the most important thing to understand is that the Chancellor has taken steps in order to ensure that we can put our arms around workers in order to ensure that they can feel confident about their future. That's the best way of making sure that more people are kept on by employers, that the economy can grow again in the future, and that the mixture of different instruments at the Chancellor's disposal, including borrowing, are there in order to ensure that we can see future economic growth. Tax decisions in the future will be a matter for the Prime Minister and for the Chancellor. But on international comparisons, I don't know, Stephen, if there's anything more you want to add.
Yes, so I think there's a few points about international comparisons. So firstly, there are differences between countries in how the virus has come to light. So in some countries, for instance, Italy, where in northern Italy there was a very concentrated spread of the virus in a particular part of the country. So countries have responded in different ways, and the virus has emerged in different ways. And we can learn from that, but it's not the virus has not made it manifest itself in exactly the same way in every country. Second point, as Michael said, is that different countries have different health systems, and in fact one of the great strengths of the NHS means that we are in a position to coordinate care very well. So, for instance, in London at the moment, which is the part of the country under most pressure, hospitals can support each other. It is possible to move equipment, it's possible to move patients very easily. And that's because we have an integrated whole country health service that is very used to doing that and can work together very quickly. But the final point I'd like to make is you do see differences in approaches between countries, but the fundamental science underneath this and the fundamental objective of all the approaches is to reduce the transmission rate. So everything that you see in every country, including all the measures here, are designed to reduce the transmission rate. It's very simple maths. If one person infects two people, and those two people another two, then the virus increases at a very fast exponential rate. If we avoid contact with each other, and for instance, for every two people, one person is infected, then it will very rapidly decline. And that is the fundamental approach that every country is taking in the measures that they take. So you may see subtlety in the difference of the exact measures, but the objective is exactly the same, to reduce the spread of the virus.
Thank you. Jenny.
So just adding a little bit of detail to that, perhaps, on the epidemiology. I think you were mentioning South Korea and Germany. So South Korea was a very particular example in a way, in the sense that it had a very significant outbreak in 2 locations. And in fact, the way that it deals with that has been the same that we would deal, for example, with an outbreak in a care home. We are still very much contact tracing in detail those outbreaks to contain them. It was a very unusual event. I think they have had 162 deaths for 9,786 cases, and that's probably not too dissimilar a balance to the UK figures actually at the moment, but I'll come back to that. Germany is very interesting. They've had 62,285 confirmed cases, 590 overnight. But significantly fewer deaths at the moment. But I think what I wanted to use this example for is just to show how difficult it is to compare countries, because in the German testing system, the proportion of the population that have been tested is considerably skewed towards the younger end. Now, in due course, it's very likely that older people will come through their system as well. We really need to, we will not be able to answer this question, to be honest, until right at the end of the outbreak. If we look back in a year's time, we will be able to compare who we tested, what the demographic of the population was, how many people of what age, the different geographies and the different testing principles. But it is not possible to do that at the moment. But I think just to reassure viewers, we have looked particularly, we always want to learn from other countries, and a colleague of mine has spoken directly with the epidemiologist at the Robert Koch Institute in Germany to ensure that we are, as Stephen said, using comparable techniques and that we're not missing anything that we could be applying here.
Thank you, Charlotte. We'll turn now to Jason Groves of the Daily Mail. Jason.
Thank you. The rise in the death toll today is shocking. Can you give us any idea of when the peak might come and how much worse that death toll might get in the meantime? And on testing, you all seem to agree that we need more testing. You've said there's a global problem. But Germany's testing 70,000 a day. We're struggling to test 10,000 a day. Why are we doing so badly? And do we ultimately want to move to a system of community testing so that we can actually get out of this lockdown situation?
Thank you, Jason. You're absolutely right. The increase in the number of deaths is deeply shocking, disturbing, moving. And that's one of the reasons why, as Stephen pointed out earlier, it's so important that people maintain the social distancing measures in order to improve and increase the resilience of the NHS and to slow the spread of the disease. We've been asked before when the peak will come. Well, there's not a fixed moment in time. There's not a fixed date like Easter when you know that the peak will come. It depends on the actions of all of us. We can delay that peak. We can flatten the curve through our own particular actions. And on testing, it is important, you are absolutely right, that we increase the number of tests, and that's why the international work that the Prime Minister and the Health Secretary are leading is so important. But I'll just ask Stephen and Jenny to say a little bit about some of the testing comparisons which may or may not be valid and some of them which are perhaps more illuminating. Stephen.
So maybe on the deaths, so deaths numbers will vary from day to day, and I think what's important is to look over a number of days rather than from one day to the next. For instance, over the last few days we've seen a decrease. So I think it's important to look at a series of days rather than an individual day. But as I said earlier, the sequence of progress that we will make here is that we will likely see a reduction in the number of infections first, followed by a reduction in the number of hospitalizations, probably a week or two later, and then finally a reduction in the number of deaths, because that clearly is a sequence: infection, hospitalization, and then, unfortunately, for some, death. So I expect that we will still see, unfortunately, a rise in deaths because that is the measure that, unfortunately, we will turn around last. So, as I said earlier, on the infections and on the rate of transmission, green shoots, but those green shoots will take a while, if they persist, to translate into reduction in hospital admissions and deaths. And I think maybe Jenny can take the testing question.
So I think the important thing is we want to be testing where it is useful. Otherwise, it's a wasted effort, and we definitely want to be doing more testing. But you mentioned community testing. We have excellent community testing in this country. That's how we manage normal outbreaks, and we're very successful and internationally renowned for that. And we have applied community testing very robustly and containment during the containment phase. And I know this can be quite difficult for people to understand when you say you're switching to a different mechanism. It's not that we are not testing. What we're doing is focusing on using testing for clinical care as a priority, which I think people understand completely. And then secondly, around getting our frontline workers and actually then everybody back into safe work. At the moment, if you were a member of the public and you tested positive, you would not be taking any different action to the action that we are asking you to do currently. If we send a clinical team out to test you at your home, we will be using capacity we could be using in the health service. But the test that I referred to in an earlier question around a postal test, which we are trying to ensure is a robust test to use, would be extremely useful both for our health service workers, getting families back running again from their isolation, and to understand the epidemiology of the disease. But I think we also need to be back on this, it's the have you got it and have you had it test, because the have you had it test is actually the secret to your answer about the lockdown element. If we know how many people have already had it, we will understand the proportion of the population that could still get it, and that gives us the clue to a number of things. For example, if we are able to develop vaccines going forward, we would know how many people we needed to immunise. If we are going to take lockdown measures off, we can model to say, actually, we know this proportion of the population is still likely to get the disease, so what happens to our second spike, potentially, if we take them off? So those tests are just as important, and at the moment, we have started a number of tests at the Public Health England facility is one, and then other scientists working in testing cohorts of people, groups of people, which are age specified, if you like, so that we can start to get a good idea of how many people in the population have had it, and then extrapolate that number out. So we get a picture for the whole country. So that actually is more of a clue in many ways to managing the end of the outbreak and when we can take the locks off.
Thank you very much, Jenny. We'll now turn to Hugo Guy from the Eye. Hugo.
Thank you. Professor Powis, can you give us any more information about the NHS's critical care capacity? Are there any figures available about on to what extent that capacity has been filled so far, to what extent that capacity will be filled? Do we still expect that demand will stay within the NHS's capacity? And are there any issues on specifically the question of how quickly people can come out of intensive care once they go in? Are we still satisfied that all those figures all those models are working in the right way so that the NHS can stay within capacity throughout the whole outbreak?
Thank you, Hugo. Stephen.
Yes, so as I said earlier, our plan is to increase capacity, and in particular to increase capacity of beds that can be used for patients, for individuals who need to be ventilated. So that is put on a ventilator machine to support their breathing. And that is what we've been doing over the last month or so, and that is what we will continue to do. So if I give you London as an example, because London is the part of the country that is most under pressure at the moment. Typically, we have around 700 critical care beds in London, and our first surge has been to double those up to 1,400. So we are increasing every day. We are well above 1,000 now. We haven't reached that surge capacity within the hospitals of 1,400. And the number of people on critical care in London is still below that number. Now, of course, we have patients on intensive care, critical care units who have conditions other than COVID-19, and it's important that we maintain, and we are maintaining, the beds for those patients, although as we have stepped down elective surgery, that also gives us more capacity because in complex elective surgery, people can require intensive care beds. So as I said a few days ago, and it is still the case, the pressure is building on London. We are seeing increases every day, but we still have headroom and we still have surge capacity to move into. And of course, the Nightingale Hospital in East London is an additional facility where we have built additional beds that can be used for ventilated patients. That will be ready to come on stream later in the week should we need to surge out of our hospitals into the into the NHS Nightingale. And as you know, we have plans in Birmingham and Manchester for a similar model, but the rest of the country is a little bit further behind. So we are within capacity. Pressure is building. If the measures that we have implemented work, as I said earlier, then that will start to relieve the pressure, which is why it's so important we all keep to them.
Thank you very much, Stephen. And we'll turn now to Torquil Crichton from the Daily Record. Torquil.
Hello, Mr. Gove. Mr. Gove, you talked about reducing contact as ministers do every day, but at the Daily Record we get reports every day from employees being asked to turn up for work at what most people would consider non-essential industries. This isn't just a London problem. In Scotland, trade unions report construction and maintenance, road maintenance continues. Insurance call centres tell their staff their work is essential. We even have defence contractors continuing to build precision-guided weaponry, hardly life-saving industries. As the First Minister said today, we can rebuild the economy, but we can't bring back lives. So why are we continuing to risk lives and the health of frontline staff by allowing people to go to non-essential jobs? Isn't it time for new guidelines on who should and who shouldn't be at work? And one for Jenny Harris, perhaps. Last week, we had a healthy 21-year-old succumb to coronavirus, and today, sadly, we heard of the death of a 19-year-old, apparently with no underlying health problems. Are young people wrong to think that coronavirus is just something that affects old people?
Thank you, Torquil. I appreciate that when people are considering decisions about going to work, the one thing that they want to do is to know, am I doing the right thing? Well, we've stressed that wherever possible, people should work at home. Now, that's easier in some jobs, careers and professions than others. But there are people who are going to work in construction and in manufacturing and in food production and supply who are contributing to making sure that the broader health and well-being of the nation is maintained. There's clear guidance on the importance of social distancing. If it is the case that any employee feels that, for example, their work in a call centre, which can often be vital to making sure that services are provided, is not consistent with Public Health England or other social distancing guidelines, I hope they'd get in touch with me and indeed with your excellent newspaper so we can point out to their employers the vital importance of making sure that people are kept safe at work. There are some roles which require people to work in the workplace, in manufacturing and elsewhere, but social distancing rules should be followed wherever possible, and no one should feel that they're unsafe at work. And I'd also say that trade unions have an important role to play here in making sure that employers are aware of their responsibilities and obligations as well. But Jenny.
Thank you. Yes, I mean, how sad is it that two very young people at the start of their lives have lost their life? And I'm sure that has come as a huge shock to their families. I think we have been clear that although what we know about this disease is that in general, younger people are not having significant severe illness, it is the case, very sadly, and it is actually the case with flu, for example, although we perhaps don't communicate that frequently, that young people can still be affected. I think in some of the, and I don't wish to put an ageist picture on this at all, but I think because when you're younger, you tend not to think of death, dying, and that it's not something which is part of your usual consideration. It is quite easy, perhaps, to not think of yourself as a part of the the risk or part of the affected group. And so they are really sad reminders that it doesn't matter what age you are, you should be staying at home and observing all the social distancing measures that we have highlighted. And obviously for anybody, regardless of age, if you are ill or if you're self-isolating and you don't start getting better after a few days, then you do need to consult the medical services, dial 111 or 999 as an emergency.
Thank you very much, Jenny. I'd like to thank Jenny and Stephen very much indeed for joining me. Thank you all. Thank you.